So my name is Jeff. I'm a family doc and an emerge doc. I am calling in from traditional and unceded Liquitok territory, also known as Campbell River, and I'm very happy to have the privilege of sharing with you today. I work in a couple of different environments, mostly in Seike and Kwaracha, two remote First Nations in northern BC, about 500 kilometers north of Prince George, and I also work as an emerge doc in some virtual services. So today we're going to share a little bit about substance use disorder, but in the sort of rural and remote context. And there are a lot of similarities to urban context, but there's lots of different nuances. And so we're going to chat about that. Why is this important? Um, I was reflecting back to 2017. And so in 2017, um, amongst First Nations Health Authority, we did not yet have OAT protocols. And I remember going through that process. And, anytime like you start something new, it's always hard and you're working through challenges. And I can think of four people that I was really close to who passed away from opiate overdoses while we were writing our protocols. And uh, and just how hard and how dark it felt at that time. And now things are still hard and things are still dark. But I do feel like the opportunity for us to support people in different ways is there. And so when I travel up north, often we'll have clients who will help us travel from one community to another. And so a couple of weeks ago, I was traveling up north, and the person who came to pick me up is someone who's really important to me. And when I look through her journey, there was many times where I think neither of us would have thought that she would still be alive. Just through all kinds of different trauma and challenges and parenting and substance use and relationships and everything. And it just brings me so much joy to have her like pick me up. And we drove down, you have like an hour to chat and just to chat about life. And yeah, I think that like that's why this is important to me, is because it makes a difference in people's lives as well as like in our lives as healthcare people. Next slide, please. So what's rural and remote? BC and Canada, we have tons of rural and remote. It's actually most of our geography is rural and remote. So what's the difference between the two? Well, there's like different, whatever definitions that we use. But I think of rural, like I live in Campbell River, right? Campbell River is a small place. But the thing is like, you keep getting smaller. So like Port McNeill, Port Hardy, Corman Island, those are even smaller. And then you go to tiny places that are very, very isolated. And that's how I think of remote. So Seike, Quaracha, Lac Olams, there's so many places in our province that are truly remote. Many of these places have water access challenges or very long distances, and they're really hard to get to. Next. So yeah, here's a map. So the place that I get to work is sort of in the middle part of the province, very close to the top in the purple there. Th There are tons of places that are remote in BC, and part of it is our geography. We have lots of mountains and we have lots of water. And so that makes a lot of places that are remote. I think one really important thing, though, to contextualize about this is that people have been living in these places for a extraordinarily long time. And the reason they live there is because that's their home and that's where they're from. And so, yes, there are lots of challenges around accessing healthcare and infrastructure in places. Um, and I often one of the things that I sometimes struggle with when I'm doing like transport calls is, I'll hear things like people will say, like if people choose to live in a place like that, then they need to, be prepared to accept, like whatever else. Um, People often don't choose to live in the places that they live, and they live there because that's where their family is from. And then there are all kinds of other layers around colonization that have impacted that. And next slide, please. So there's this saying that all rural people use that is if you've been to one rural community, you've been to one rural community, and they're all different. They're culturally different. The challenges that, there's overlap, but actually there is so much diversity. And I think one of the incredible things about British Columbia is the incredible diversity amongst our First Nations brothers and sisters, and all of the the incredible depth and distinctions between the different cultures and the different languages and the different practices. And so all of that does come in. But yeah, it's very important to just recognize that every place really is actually quite different. Next, please. Um, One of the things that I think is also important for people just to always consider is that it's the most remote communities that often contribute heavily to infrastructure in our province. Um, and the communities where I work, one of the reasons they're so isolated is because there is a large reservoir that provides electricity for about a third of our province. That's one of the reasons they're so isolated. Um, um, we definitely see a very significant part of our provincial Indigenous population living in rural and remote communities, and there is unmistakably an impact on the social determinants of health in this area. And we could talk for many hours about that, but it is really important to acknowledge that. Thanks. Thanks. The last couple of years have been really hard to watch, and when we look at um, deaths related to substance use in rural and remote communities, and in particular Indigenous communities, there's been an, in- incredible shift in the number of deaths and the impact. And one of the like certainly we've seen this in opiate use. You know, my more recent experience over the last 3 years is around methamphetamine use, and it's really scary. It's hard when there is no RCMP detachment in the community where you live, and there are many people that you care about who are frequently using meth and are very, very confused and aren't, perceiving reality and at times are really violent. It is really, really scary. And so, I think we all intuitively know this, but it's not just impacting the individuals who are consuming substances, it is impacting everyone in so many different ways. And yeah, it's really, really hard, but there's no question that we're seeing this disproportionately more in rural and remote areas. Next slide, please. So there's a number of reasons why. Um, and I think the one piece that I would put forward here is acknowledging the impact of trauma, specifically intergenerational trauma, the impact of colonization, of residential schools, of flooding of territories. Um, when I look at the clients that I have the privilege of caring for, it all connects to that. And I think one of the reasons that's important is because then in supporting people, right, that like taking that into context is really, really important. And then certainly some of the financial hardships, as well as the isolation that are connected with that, really do have a really big impact on that. Next slide, please. So this is so yes, a shout out to the people who wrote this presentation because you did such an amazing job, and I'm so thankful. And I love these pictures. So lots of challenges, right? Not many providers. One of the big ones is pharmacies. So the remote communities do not have pharmacies. And so that really does change the dynamic around different types of harm reduction treatment. Certainly stigma is a challenge in the smaller places you go, everybody knows everyone. And oftentimes it's really hard, if people think that you're something, getting them to think that maybe things have changed a bit is really, really hard to do. I think the other part is, there's the picture of the car. In many of these places, people cannot leave. They cannot get out. So whatever happens to be available or they have access to in their community, like that's it. People don't have choice. And certainly some of the virtual options have adjusted that. But that really is a predominant theme. Next slide, please. Okay, so I think this is the most important one. So what helps? So we know that we don't have enough people who are trained in substance use. And we know we don't have pharmacies, so doing like daily pharmacy visits is hard. And monitoring, like a lot of the things that we typically would use in our protocols, you literally can't do them. However, what do we have? What we have is relationships. Um, and I think of I work in hospitals at times, and it's like there's no way, you're getting into that building and working in that place if you haven't done like your CPR level C or whatever, right? Um, when I think of substance use, and how can we support people with that, um, the tools, the clinical tools that we have to support people, are so important for everyone to have some level of understanding of, because my experience in rural and remote is the most important person who's going to support someone struggling through some of these issues is the person they have a relationship with. That might be a nurse, that might be a community health rep, that might be an NP or a doc, or it might be somebody on the computer, like who knows. But it's um, going through that with whoever it is that they have a relationship with is everything. And so, despite all of these challenges, there are often very strong relationships in rural and remote communities. Next slide, please. Rural and remote communities are very resilient. The people in them have been through a lot, and they um, have struggled with so many challenging things. And I think that's it, in my experience, it's the connections that exist inside communities and often the connections to traditional wellness, whether it's being on the land, whether it's being, part of hunting or gathering or supporting elders or supporting others. That's what keeps people going and people healthy. I think oftentimes there's this tendency for us to undervalue some of those things that they're like, okay, well, that would be nice if we did that, but truly, I think there was this period of time where we thought of treatment being like going away and doing something and then coming back. And I think we've learned that's not super helpful in all circumstances and many circumstances. And so really building up the strengths that are in community is really important. Next. Um, I love this quote. I the most successful intervention is kindness and humility and human connection. And that is truly what matters, I think. It's that tenacity to walk alongside someone for a really long time and to support them. And so that's why I do think many of these virtual strategies that, we'll talk about in a sec, like they're important, but they are not super useful if someone is not connected with other people in their life, like real human beings in person. All those other things are like, add-ons. And so I think that is the role that all of us can play in all the different places we work is whoever the people we're interfacing with in real life. Um, I think we can play a huge role. And then all those virtual things just become like ways to help us do that better. Next slide, please. There's all kinds of tools that have been deployed across the province, some in person, some of them are remote. They're like, you know, and actually one interesting thing I find is that many of the most remote communities have a very long legacy of harm reduction spanning decades. And I've always found a lot of, I mean, it can always be controversial, let's be honest, but in general, um, in the tinier places, I find that there is a safe place to have these discussions, provided that there's that trust in relationships. So, rural and remote communities, and in particular First Nations communities, have, over many decades, been exposed to being, people being tested on and researched done on them, without their consent. And so there's always lots of questions that get asked when new things are coming, but with strength and trust and relationships, then you can have some of those discussions. And so it's really important. But obviously, like the solutions are going to look different in each place. Next slide. And then of course, like there's all kinds of new ways to support digital access for harm reduction. So there's, Brave is what's noted here. There's apps. Again, though, I think one thing I hope everyone can kind of take home from this is I don't think, like, in the absence of relationships with people, these things become less useful. But in the presence of relationships with people, then these things can be really strong tools that sort of can really enable that. Next slide, please. Um, I think this is critical. Um, I have had so many people that I've cared for over the years who have died when they've left their communities to receive care. And it might be like going out to see the dentist or going out for a specialty appointment or going out for an x-ray or so many different things. But in communities, people have people who look out for them, who support them, make sure they have food, all those things. When people leave and go to a different place, that does not exist. And so any strategies that we can use to support people to live in the place they want to live in, or maybe are stuck living in other circumstances, I think is one of the most impactful things that we can do. Of course, people choose to move around, and that's different. But oftentimes the history in healthcare is that we force someone to like leave one place and go to another so that they can get treatment. And the more that we can do that at home is really important. Next, please. This is similar, just yeah, how do we support people to stay in community? Next. There's some really interesting stuff that's coming out, with pharmacists, and that can support. But I mean, certainly that affects more of the rural community as opposed to the remote, where there aren't pharmacies. Next. So lots of different virtual options. Virtual is really, really good and has really changed um, the dynamics. But again, it's critical that we're still building those in-person continuity relationships because it's hard to do that virtually. Next. So there's FNDOD, it's through Zoom, it's client facing. There's also what we call VSUPs, and that's referral based. There are other also, next slide, please. There's also lots of um, there's peer-to-peer as well. So there's some where the client can access something, and then there's all the other programs where a provider can access help. So this opioid treatment access, yeah, that's more of a client-facing one, and so it's on the phone. Next, and then these would be the more like peer-to-peer, right? So that's like somebody like me calling someone and saying, "Hey, can you help me with this?" That's really important. And for those of you who are the people giving help, yeah, just how can you have that curiosity around supporting your rural colleagues and thinking about, some of their challenges? Next. There's also lots of different training that's available, and these slides are you'll be able to have all this information. Next, um, and this just gets back to what I was kind of saying earlier. It is absolutely critical that we enable every clinician who has direct access to patient care to be able to participate in this because, yeah, there are lots of places where we have no providers visiting NPs or docs. And so having nursing playing this role is absolutely critical. Next. Yeah, it's been really exciting to see this brought into the nurses like expanded scope of practice. Next slide. Okay, so does this matter? Yeah, it totally matters. We have so many incredible cultures across our province. We have so many little places. And sadly, in those communities, we are seeing much higher rates of substance use and much higher rates of death. And do we have ways to help people? Yeah, we totally do. But we need to think about it in a different context. And I guess my plea to all of you is if you're someone who lives in a small place, continue to build partnerships, continue to learn about this, reach out to others for help. If you're someone who isn't in one of those places and people are reaching out to you, just really think about how um, the context of that person and the advice that you're giving them. And together we can continue to expand access and continue to improve patient care. Thank you.